An apparent reversal by the FDA. Taylor Farms says the FDA apologized and is walking back its claim that it found traces of the parasite Cyclospora on a sample of its lettuce. There have been thousands of illnesses across the country. The outbreaks, you've heard of them, of explosive diarrhea. A source tells CNN that funding cuts by the administrations created a perfect storm. CNN medical correspondent Meg Terrell is here with all the details here. So we thought we knew where this was from, but now not so much?
Well, so the FDA announcement over the weekend caused a little bit of confusion. And so essentially they had said that they had this positive test result of Cyclospora, and it was on a sample that actually hadn't been included in this recall. And so now they're saying that's a false positive. Taylor Farms is saying the FDA apologized about that, but it doesn't actually change the fact that this recall still stands. The trace back still stands to the lettuce that people ate at Taco Bell and this broader recall. And so Taylor Farms has recalled this lettuce from central Mexico, this iceberg lettuce. But we also have new reporting this morning about what a lot of public health experts have complained is a slower than expected response from the CDC and the federal government broadly to this outbreak. And just to give you a timeline, the first illnesses started in mid-May. It was July 1st that Michigan warned of an outbreak. And of course, we know there are so many cases in that state. But then it was 2 weeks later that the CDC issued its health advisory. And a lot of public health experts said, why did this take the CDC so long? 2 weeks after Michigan. They said it should have been much earlier. And so our reporting from our investigative team, my colleague Brenda Goodman on the health team, they talked with the head of a former federal lab that was responsible for tracking outbreaks of parasitic illnesses. That staff at that lab had been cut from 11 to 3 last year by the time that the director of this lab, Dr. Joel Barrett, resigned in September, warning his superiors that the cuts to that lab could affect their ability to track outbreaks quickly in the future. They also were affected by cuts to USAID funding because they did a lot of work on parasitic illnesses. Malaria is a parasitic illness. There were a lot of sort of shared resources that affected this work. Cyclospora, of course, is a parasite. And of course, there was 25% reduction in CDC staffing last year. And so what we've heard from Dr. Barrett as well as other sources is you're missing the expertise, the specific expertise in this area because you've seen those kinds of cuts. And also you're missing the sort of all hands on deck ability for people to pitch in when you have just fewer people at the agency. Now, the White House disputes that there's been any delay here. They also note the USAID funding was not for domestic response, it was for international response. They say the Trump administration's top priority is ensuring the health and safety of the American people. So
where do things stand, though? I think what everyone wants to know is this thing coming for me?
Right.
Where, is it still spreading?
So we don't believe so. What we know right now is that there have been more than 7,000 cases that have been either confirmed or are under investigation. Most of them concentrated here in this 5-state outbreak, and Michigan really having more than 5,000 cases. But 34 states have reported cases of cyclosporiasis. Some of those are under separate investigations. These are not necessarily all linked to one another. Of course, we mentioned that false positive. The FDA saying now that there are no confirmed positive sample results. That doesn't mean that this investigation, though, has changed in terms of what the recall affects. Taylor Farms, of course, saying that the FDA apologized about that. Now, Walmart has said over the weekend that it was recalling these potentially affected, though they haven't tied them to any illnesses, products. Iceberg salad, shredded lettuce from the Market Side brand. And it's important to note these use-by dates up to August 3rd. So folks should check if they've bought any iceberg lettuce under this brand. Check your fridges, make sure you don't use it, toss it out. This is what that Market Side brand looks like. But more broadly, of course, this has really been tied to Taco Bell, which said it's recalled those products. They should not be in stores anymore. Jack in the Box said it also had recalled some of those products, made sure that they were replaced by a different supplier, as well as these other brands.
How big of a health concern is this right now? How are you categorizing this in your head?
On a scale of 1 to 10, this is somewhere around a 3 or a 4. Now, this is the biggest Cyclospora outbreak that the United States has ever experienced. It is a really unpleasant illness. To be explicit, it is explosive diarrhea that comes and goes for weeks on end. But it's not, by and large, a super dangerous parasite. For most people, excluding the elderly or the young or the immunosuppressed, for most people, it is just unpleasant and it is easily treatable. There is a very common, inexpensive antibiotic that eliminates it once it's been diagnosed. What I do find concerning, and why it's not a 1 or 2 in terms of my level of concern, is because of how big this outbreak has been and because of how long it took us to identify the source. That makes me worried, just as in the very early days of the hantavirus epidemic or hantavirus outbreak. It makes me worried about the capacity of our nation's public health system and about how we would handle things if there were a super serious, super dangerous pathogen here in the United States.
So let's get into that a little bit, because look, this illness did hit a lot of people in a very short time across many states. How does something like that happen, and where do you even begin to sort of peel back the path, the contact trace, in a sense, of where this may have originated?
Yeah, so Cyclospora is a little bit complicated. There are lots of foodborne illnesses. Most of them show up within 1 to 2 days of eating or drinking something that's contaminated. For Cyclospora, it takes 1 or 2 weeks before you start getting symptoms. And then on top of that, we don't normally test for Cyclospora in the doctor's office. If you come in with those stomach upset symptoms, the doctor has to actively think about it and actively order the test. So it makes it tougher for us to even start to see the signal that there is a Cyclospora outbreak. And then finally, that process, as you said, of figuring out where it came from, that requires what I call shoe leather epidemiology. It requires there being trained public health professionals who go and talk to the people who have the infection and try to figure out what it was that they ate, look for that signal of the common food or common drink between all the people with the infection, and then go back and do the testing of the site. Now, because so much defunding has happened at the CDC, at the FDA, and then with a trickle-down effect for state and local health departments, that process was slower this time. We have fewer trained experts out on the ground. We have less coordination between the different agencies, and we have less reliable national counts of disease than we would have had 2 years ago or 6 years ago or a decade ago. So that's what has made this outbreak a little more complicated, and again, what gives me some concern about the future.
And, you know, in terms of what comes next, obviously, you know, we've gotten some clues as to the supplier this came from, some places where people may have had this lettuce. You know, it provides at least people some context. But then the next question becomes, well, when can I kind of go back to eating shredded lettuce in the way that I was before, or the iceberg lettuce in the way that I was before? How soon can people feel safe about doing so? What is that time frame typically like?
Yeah, so Taylor Farms, as you said, has recalled all of this lettuce. It's going to take a little while potentially for it to come off of the shelves. I would recommend to people that they avoid eating that bagged shredded lettuce for a little bit longer, a few more days, another week, and then they can go back to eating it. In the meantime, eating other brands, locally grown lettuce, hydroponically grown lettuce, all decreases your risk. I think for all of us, this serves as an important reminder that being healthy, eating healthy food, is about eating nutritious food for sure, about avoiding chemical additives, which is what a lot of the current federal government has been talking about. It's also about having access to food that is not contaminated with disease-causing organisms. And that requires a significant system in place to make sure that we all stay safe. So for viewers, you can go back to eating lettuce, be careful about where it comes from for right now, and then go off and enjoy and eat lettuce, eat fruit. If you are one of those people in a high-risk group, make sure that you're careful about washing your produce well.